responsible for during the time. Depending on the illnesses, there are numbers of treatments someone could go through. There are different levels and various of these, and even different beliefs regarding what may be more effective. So, respiratory illnesses have unique treatments options, and understanding them and important steps in your caregiver. So, when we come to the oxygen therapy, there it's the most common respiratory illnesses therapy. Depending on the diagnosis, oxygen therapy may be appropriate treatment. It can be help in many diagnoses in lung cancers, pulmonary fibrosis, pneumonia, severe asthma, sleeping apnea. Yes. In this treatment, it can help the patients stay active and feel better overall. It is used at least 15 hours per day. Oxygen therapy is said to increase the survival rates of in some cases. In this case, there will be a done at home. Some understanding how to help the and how to process work or what is vital. Depending on the what the doctors recommends is the types of oxygen therapy may be differ. So in the knowing how to assess the patients is important, but understanding these the safety steps may be given to the more vital in the caregiver in role. You have to go through the these rules and go through this role. You must never smoke near an oxygen tank. Do not use flammable products in the same vicinity. Keep tank upright and with the and stay 5 feet away from the oxygen tanks. Avoid products with oils, greases, and petroleum. Always keep a fire extinguisher nearby. Inform the electric company of your oxygen tank for prior power outage. In this in such situation, there may be a numbers of reasons why patients is hesitant to try oxygen therapy, such as the difficulty of it or how they will accept it in socially. But the benefits far outweigh the concerns. These benefits include the increased chance of survival, reduced symptoms and complications, not only that, increased ability to exercise and overall better quality of life. And because this treatment is that will help and that will be primarily we can do at it home, ensuring there is a safe environment and you are aware of the proper treatment methods and plan will be make the job of the career run smoother and provide better environment for the patient. Pulmonary rehabilitation. In pulmonary rehabilitations, we use pulmonary rehabilitation program, incorporating exercise and educating to the help of patients who are suffering from the respiratory illnesses, manage the breathing problems, increasing stamina, and raise energy levels, and decrease breathlessness. Depending on the individual's ability to exercise and the levels of which they are able to do exercises of physical activity, this treatment may be altered. There are numbers of treatment with the plan that can be incorporated. In not only that, many of which can be done at the comfort of the home. We can do it all by ourselves within the home. And it mainly consists of exercising training, energy conserving techniques, breathing strategies, nutritional counseling, and group of support. So when we become to end of life care, there are palliative care as well as actually, palliative care is the treatment methods that works to improve the ability to and the quality of the life for patients who are testing pain, treating with the pains, and the testing with the diagnosis examinations pain, and the helping to decrease these tiredness and these levels. This form of treatment is common for those uh, who have the respiratory illnesses, and not only that, and it can be oftentimes be the only form of treatment when battling a rare illnesses such as mesothelioma, is like or a cancer that affects the lining of the stomach, heart, lungs. Mesothelioma is frequently diagnosed in the late stages, because it can't we can't diagnose it is it in the basic stages. So in the beginning, not we can't diagnose it. So often making palliative care roles only treatment option for a patient. In most cases, those receiving palliative care will have a team, so consisting of a doctor, nurse, and a social worker. Not only that, although this form of treatment will most likely happen within the hospital, and the importance of the helping of the patients while at home should be also taken under the consideration of the deemed a priority. Palliative treatment usually occurs during the uh, same time. Most commonly it's used it's same time, and in the cases that the deemed priority, and the within the frame of the normal treatment. So it's important for a patient to receive positive support for both in home and the out of the home or the caregiver. So I think this video is useful for you. Thank you.